A third example of materials applications I'd like to show you that I think is also very exciting is what we call microbial fuel cells. And microbial fuel cells take advantage of bacteria that are in soil and digestive tracts. They're not genetically engineered whatsoever. The microbiology isn't all that interesting. But as it turns out, there are certain materials that we can use that microorganisms can grow on, where microorganisms, as they break down organic matter, here I show glucose, but it could be any waste material, where they take the electrons that come from the breakdown of this and actually dissipate the energy through a fuel cell. The traditional way of treating wastewater or sanitation is to try to bring oxygen into the waste. We reverse the process here, where we try to bring the energy in the waste to the oxygen. And it relies on the ability of bacteria to actually take energy from the breakdown of the waste, dissipate that energy on a material surface. This happens very, very easily in the laboratory. And then here we show the ability to actually capture the energy. What's interesting about this? A lot of things. First of all, we can rapidly speed up the decomposition of waste. That is inherent in advancing sanitation approaches. The second is, I'm going to make electricity from this. I can light light bulbs with this. I can charge cell phones with this. I can create a market with this. Maybe. We're still trying to explore the market options. But if we could actually turn waste, breaking down waste, into something that produces a very useful product, the idea of markets come into play very quickly. This is something that we're trying to test today. Advantages of this approach, very simple. It's really not hard to do. We're trying to turn a pit latrine into something that is an electricity generator. That's kind of the fundamental concept. Decomposition rates are increased. We create this product. Our questions really have to do with material durability, design, and how do you build a business model around this? Is there a way for someone to actually make $1 a day off of running a pit latrine? Don't know the answer to that yet, but it's an idea. So those are examples of some innovations that we think that illustrate the potential that are coming out of laboratories to sort of change the way we approach treatment in the developing world. I think there's a lot of other examples that we just don't have time to do. The concern that I have and others who are doing this kind of work is what we call the valley of death. In technology development, there is this term called valley of death, which is the difference between a really cool idea and actually seeing a market that's developed from it. And you have to go through the valley of death. And the thing is no one makes it through the valley of death alone. If you try to go it alone, you're not going to make it, and your technology is going to sit on the shelf and be a neat publication somewhere. One of the things that we're trying to advocate and trying to create at Tech and with other universities around the world are the interactions with people who are involved in technology development, like me, and recognizes I can create stuff, but it's not going to get used, with the people who can help me actually determine markets, move it towards market, and understand the needs on the ground. So that if we're building some new technology, we're building it with the right thoughts in mind, that it might actually help somebody in the end. And I think it's very, very important, and one of the reasons I wanted to be here was actually to reach out to a broader community to say that we recognize that, or many of us who are involved in this kind of research I'm illustrating today, really recognize the need of working with the people in this room if we're ever going to make any progress in solving global water challenges. This is a diagram it's intended to be simple. I think there's a lot more complicated steps than this, but I'm just trying to illustrate some of the complexities. I've been talking today really on the innovation side of the spectrum. How do we create new approaches? What we need is implementation. And that's an arrow that goes both ways, because obviously we'll learn in implementation what we didn't know in innovation, and we're going to have to go back and forth. But in the middle, which represents that valley of death, is the need for interdisciplinary, or really transdisciplinary interactions. People who understand markets, people who can help us with human factors, or that we can help with technology. We have to consider sustainability, which is complex on its own. Appropriateness of technology, will it be accepted, those kinds of things. And I will be the first to tell you that when it comes to cultural barriers, I need a lot of help. I really do. Ask anybody. But I was being facetious, but it's really very important. And the amount of time that of course I don't have a public health school on my campus, but the amount of time I get to spend with public health people is pretty limited. The number of time I spend with people in the business school is pretty limited. et cetera, et cetera, et cetera. We're working with NGOs is pretty limited. But I really think that somehow universities do need to come up with an approach that allows these organizations to work together in pretty close proximity if we're ever going to take advantage of what universities can provide for solving some of the global health challenges. So we're wrapping up. Taking what we do in the United States and moving it to the developing world is really going to be a very difficult long-term challenge if it can ever be done. I do think there's some very exciting opportunities in technology that if evaluated correctly, may provide some really interesting changes in the way that we approach water challenges and health challenges in the developing world. And without a transdisciplinary approach, I can guarantee that there's not going to be a success. And before I decide to step down from the podium, I am going to ask everybody to move this direction. We have people in the hallway who can't get in. And so if people would just stand up and start filling this way. Thank you for your attention.